Good morning, everybody. Thank you for joining us today. Health for Inclusive Growth, covering Economic Summit, Health for Development, and Health Tech for Saving Lives. This program is being presented to you by the Bengal Chamber of Commerce and Industry, CENERS-K, in association with Medica Superspecialty Hospital. We are commencing our program now. Our participants and audience who are at the Bengal Chamber, if you may please keep your phone in vibration mode, it would be convenient for the proceedings of the program. In the opening session, we have Air Chief Marshal Arup Raha, President CENERS-K and Honorary Member and Ambassador Extraordinary at the Bengal Chamber, Mr. Abraham Stephanos, President the Bengal Chamber and Managing Director, Tata Steel Downstream Products Limited, Mr. Aniruddha Lahiri, former Director HUL and Senior VP Unilever, Convener of the Economic Summit CENERS-K and former President the Bengal Chamber, Dr. Alok Roy, former President the Bengal Chamber and Chairman Medica Group of Hospitals, Dr. Sangeetha Reddy, Joint Managing Director Apollo Hospitals. She is joining us online. The opening session will continue with a keynote panel on health for inclusive growth, where we'll have Sri Narayan Swarup Nigam, Secretary, Department of Health and Family Welfare, Government of West Bengal, Mr. Arnob Basu, Vice President, the Bengal Chamber and Advisory Leader and Partner, PwC India, Professor K. Srinath Reddy, President, Public Health Foundation of India, Ms. Suchita Gupta, Chairman cum Managing Director, National Insurance Company Limited, Dr. Rupali Basu, Managing Director and CEO, Woodlands Multispecialty Hospital Limited. It will be moderated by Dr. Kunal Sarkar, Senior Vice Chairman, Senior Cardiac Surgeon and Head, Medica Institute of Cardiac Sciences. With this, I would request Air Chief Marshal Arup Raha, Mr. Abraham Stephanos, Mr. Aniruddha Lahiri, and Dr. Alok Roy to please join us on the dais. As I mentioned, we have Dr. Sangeetha Reddy online with us. I would request Air Chief Marshal Arup Raha to make the formal welcome address.
Good morning, ladies and gentlemen. It's a great privilege for me to, welcome all the eminent panelists, speakers, delegates, distinguished guests, representatives from the state government, and as also esteemed the President and members of Bengal Chamber of Commerce and Industry, and I have my own organizations, esteemed members of CENERS-K, to this fourth edition of this Economic Summit, which is jointly being organized by Bengal Chamber and CENERS-K, the strategic think tank based in Kolkata, on health for inclusive growth, which will be held over the next 2 days, spreading over almost 8 sessions. Before I continue with my address, I would like to make a mention of a very tragic helicopter accident in Kunur, in the Nilgiri Hills, which happened on the 8th of December, involving the first Chief of Defense Staff, CDS of Indian Armed Forces, or India, I would say, and his entourage. This is one matter which is preoccupying all our minds in India and among the people in various parts of the world. So let me just give you the names, which you already know most probably, people who have succumbed to injuries because of this helicopter crash. A Mi-17 V5, a Russian-built helicopter acquired by Indian Air Force, which has been involved in this crash. General Bipin Rawat is the CDS. Others are Mrs. Madhulika Rawat, the wife of the CDS, who was also the former and the president of Army Wives Welfare Association, AWA. Brigadier L.S. Lidda, the CDS's military advisor. Lieutenant Colonel Harjinder Singh, the staff officer to the CDS. Wing Commander Prithvi Singh Chauhan, the captain of the ill-fated helicopter. Squadron leader Kuldeep Singh, also a co-pilot of this helicopter. Junior Warrant Officer R.P. Das, Junior Warrant Officer P. Arakkal, both a technical crew of this helicopter. And other 5 personnel from the Army, Havildar Satpal Rai, Nayak Gursevak Singh, Nayak Jitendra Kumar, Lance Nayak Sai Teja, Lance Nayak Vivek Kumar. And of course, the only survivor on the 8th was Group Captain Varun Singh, who actually passed away, I think yesterday, succumbed to the injuries. He was being treated at the command hospital in Bangalore. Very unfortunate. So all the 14 people on board have actually perished because of this accident. So, this Group Captain Varun Singh was a DS, directing staff or instructor in the Defense Services Staff College in Wellington, Kunur. And he was the liaison officer to the CDS for this visit to Defense Services Staff College. I would now request everybody present here to kindly stand up and observe a minute's silence in honor of these people who have succumbed to the injuries in the crash. Kindly sit down. Well, to continue with the proceedings, the progress of any nation, any people, any society is not necessarily determined by the usual yardstick of the economic growth, economic development, the gross domestic product of that nation, the purchasing power, the military power or comprehensive national power, which includes soft power and hard power combined of the nation, or even the standard of living. But to my mind, it is judged by the quality of life the society, the people enjoy in a nation. And it is determined basically by the standard of 2 very important factors, 2 important services the nation provides to its people. Firstly, having a very good, rigorous education system with an excellent base, infrastructure, sound government policies and then implementation, thus providing a very strong foundation for intellectual growth, experimentation of new ideas, thoughts, and of course action. Building character through acquisition of knowledge, integrity, ethos, ethics, and of course, providing vocational skill sets to its young generations so that they become productive to the nation, productive to the society. So in other words, the education system would inculcate a very healthy mind in our new generation and also help them develop skill sets to work in various spheres, in various professions to be productive to the society. Especially for a country like India, which is going to be the most populous nation very shortly, and it has a huge bulge of young people. If we can actually make use of their talent, give them skill sets and jobs, they will be a boon to the nation and not a bane otherwise. And the second factor to my mind, which is equally important, is having a robust healthcare system, which would include the infrastructure, the outreach, that means the capability and capacity of the healthcare system to reach out to each and every person in this country, to each and every corner of the country, every region of the country, so that especially the poor, the rural masses, and the EWS, economically weaker section of the country, are looked after. So thus, a combination of a good education system and an inclusive healthcare system would actually help the nation grow in terms of economy and also improve or enhance the quality of life. The recent and ongoing Wuhan virus pandemic has actually proved beyond doubt the vulnerability of and the significance of healthcare system, for the economy of the world as such and the well-being of the entire humankind. And this economic summit would therefore concentrate on the overall healthcare sector of our country, of our nation, and obviously it would include infrastructure and the resources available, and the government policies and their implementation, the quality in actually delivery of the healthcare service to the people. Equally important is the medical education, which will actually produce good doctors, specialists, super specialists, and healthcare sector workers, I would say, paramedical staff, etc. Research and development and use of state-of-the-art, the latest technologies in medical science for treating various ailments and diseases. And to my mind, a very important factor is environmental aspect, like pollution, sanitation, hygiene, etc., because these are the factors which would affect the health of the citizens, and we need to take good care of these issues as well. I'm the president of CENERS-K, which actually stands for Research Center for Eastern and Northeastern Regional Studies, Kolkata. It's a Kolkata-based think tank, and I'm very happy that we have a dedicated session for discussing the issues related to Northeastern region's healthcare delivery system. BCC&I and Bengal, CENERS-K have worked very hard during the last few months to organize this summit, Health for Inclusive Growth. And I must make a special mention of the architect of this summit, Shri Aniruddha Lahiri, and the team from Bengal Chamber, because the hard work put in by them must be recognized. And I'd like to thank Mr. Lahiri, who is a very, very valuable member of both these organizations, Bengal Chamber as well as CENERS-K. Thank you, Mr. Lahiri. I'm certain that many relevant issues would be discussed and deliberated upon by the eminent panelists and speakers, and there will be plenty of takeaways for all the stakeholders. Thank you. Jai Hind.
Thank you, sir. May we now request Mr. Abraham Stephanos, President of the Bengal Chamber, to please make the opening address.
Air Chief Marshal Raha, Mr. Aniruddha Lahiri, Dr. Alok Roy, ladies and gentlemen. The Bengal Chamber of Commerce and Industry takes great pleasure in presenting this program today and tomorrow with our long-standing partners, CENERS-K and Medica Superspecialty Hospital. CENERS-K and Bengal Chamber have brought forward very interesting programs in the past centered around strategic issues of the country. And it is kudos to them that they have taken up a very important issue, that's the important issue of health for inclusive growth, which is equally strategic. Sometime back, we had discussions in our company about how to improve overall health of employees and especially in the pandemic where people are locked down at home. And one of the realizations that with life, and the objective is to be happy. But you can't be happy if you're not healthy. You can't enjoy life, if you put it another way, if you're not healthy. And that is absolutely just the best reason for why we should look at health as a prime prerequisite for having a good life. Everything else comes later. So therefore, this summit is really very, very important in starting the thinking around health for inclusive growth. Today's and tomorrow's program is a blend of two annual initiatives. That's the Economic Summit Health for Development and Health Tech for Saving Lives. In the last couple of years, health has been recognized globally as intrinsic to development and economic well-being. While health is one of the Sustainable Development Goals, or SDGs, of the United Nations, many other health-related goals comprise determinants of health. Integrated implementation across SDGs is needed for the achievement of Agenda 2030, which is the proposed plan of action for people, planet, and prosperity. It recognizes eradicating poverty in all its forms and dimensions, which is the greatest global challenge and an indispensable requirement for sustainable development as highlighted by the United Nations. So poverty is also part of the SDGs that need to be addressed. Strong evidence has been identified linking income and health, which suggests that policies promoting economic equity may have broad health effects. The Chamber believes that this is an opportune time to engage ourselves and our stakeholders in a program like this. Healthcare needs to be a right and not a privilege. In countries like ours, a sizable population lives in rural and semi-urban areas where resources may be scarce. Emerging technologies like artificial intelligence and machine learning may help improve through telediagnosis, teletreatment, and telesurgery using teleoperated robotic systems and other technologies. We can extend medical reach by leaps and bounds using the technologies that are available today, and this is extremely relevant for a country like ours. Health has also been recognized as a corporate's responsibility. In 2018, the Global Reporting Initiative adopted a new standard requiring companies to report on their initiatives for promotion of workers' health. These initiatives range from provision of smoking cessation programs to free health screenings in the workplace, going beyond traditional occupational health and safety requirements. And I can tell you that in the Tata Group where I work, this goes beyond the worker themselves to involve their families, or all employees, and engage their families in moving towards greater health. Today's program envisages to address all these areas. With our partner CENERS-K, special focus has also been made on northeastern states where large-scale rural-urban variations and limited accessibility to healthcare services in rural areas have remained a concern, an area that needs to be addressed. Technologies that involve digitalization, etc., may help the healthcare sector of the Northeast to a great extent. I think the deliberations that will follow will throw more light on these issues and come out with concrete recommendations that we can act on. And I wish you all a very enlightening, educative program for the 2 days to come. Thank you.
Thank you, sir. Setting the context and moving forward, we have Mr. Aniruddha Lahiri and Dr. Alok Roy. I would request Mr. Lahiri to please address.
Development and health side by side. Yes, sir. New commission. Hand in hand. It didn't exist earlier. Good morning, everybody here, and also to those who are connected remotely. Let me add my own word of welcome to all of you to the 4th edition of the Economic Summit and Health Tech under the umbrella theme of Health for Inclusive Growth. Now, when I look around this room, and I also see the names and the list of participants, speakers, and luminaries who are going to be actually talking to you, I think it would be rather presumptuous on my part to say that I could add any further knowledge than what is already known by them. And therefore, I will deep dive straight into introducing you to the program and outlining how this has been architectured. Now, what are we doing up here then, if you're not going to add any knowledge or contribute to your learning? Well, I am here, and the same can't be said of Dr. Roy, but I'm here at this stage to briefly elaborate on the 2 themes and how they are bound together by the overarching subject of health for inclusive growth. Now, Air Chief Marshal Arup Raha and Mr. Stefanos have already stolen my thunder, thanks to them. That's what they're supposed to do. So, I have not much to say. But suffice to say that today's deliberations will focus on health and well-being for sustainable economic development. And tomorrow, the discussion will revolve around technology for saving lives. And these 2 areas have been further disaggregated, if you see the program, into their constituent elements. And this is given in the handouts that have already available with you. Now, as I said, and everybody has said, that there is this special focus on the northeast of India. And today, for CENERS-K, northeast has actually transgressed the national boundaries. So we are also joining hands with other countries in this effort. But I must just maybe remind you that if you look at the status of development in the northeast part of India, if you compare the region's contribution to the national GDP, or if you look at it, compare the state gross domestic produce, then you will find that Northeast, for some reason or the other, has not been able to make a very significant contribution yet to the national development. It hasn't. Now, which points out immediately that there is a lot of development need in that area. And that is one of the subjects that we research on and we try to promote as CENERS-K. And when I say we, I have, as Air Chief had already said, I have 2 identities, CENERS-K and Bengal Chamber. So I'm now talking about CENERS-K. We concentrate and focus on the Northeast, development of the Northeast. So, therefore, economic development will take place, it must take place, and there is a huge potential for it. But then, health and well-being of the people in the Northeast must go hand in hand with this effort. So, it is hardly arguable that sustained economic growth can only be achieved with access to quality health care for all the citizens. This is precisely why health takes a central place in the United Nations Sustainable Development Program, which Mr. Stefanos alluded to, and that's called SDG 3, Sustainable Development Goals 3. And within this, all these goals together are basically meant to ensure healthy lives and promote well-being at all ages and more importantly, across all strata of society. Underpinning these goals by 13 targets that collectively cover a wide spectrum of the World Health Organization's objectives. Almost all the other 16 goals, ladies and gentlemen, are also related to health and attainment of health and well-being, albeit some of them indirectly. And what are they meant to do? They are actually meant to create improvement in the quality of life within the carrying capacity of the ecosystem. The health sector plays an important role in linking the environment and economic development, because health in its broadest sense is not just disease and cure, but it's a more inclusive subject which talks about just all areas that contribute to health and well-being of the citizens. So clean air, water, sanitation, provision of green spaces, and safe workplace environments can enhance people's quality of life, reduce mortality and morbidity, and promote healthier lifestyles, all of which are crucial to mental health. So it's absolutely essential that mental health actually is the result of all this put together. And that's the important thing. But it also has a positive impact on entire families, especially women, children, and the elderly, in multiple ways. Apart from what is obvious, which is income gains from higher productivity of the earning members of these families and households. Dr. Roy, would you agree that a very important case in point and a very relevant one to the current context or current times is the COVID-19 pandemic? We all know the kind of devastation or a devastating impact that the ongoing pandemic had on the entire global economy. Would you agree that this is in fact a very relevant time to talk about?
Indeed, sir. That's how I'm standing next to you.
Right. So, in relation to the pandemic, I would particularly point out the fate of the migrant workers in India. You all remember the scenes. They are vivid. Without access to adequate healthcare and other facilities, millions migrated back to their homes in the villages, resulting in a crippling shortage of manpower for industries that slowed down manufacturing activities, just about all business activities, thereby impacting the economy and hampering government finances that might end up restricting its ability to ramp up public spending in healthcare to address the very problem that led to these circumstances. Such negative feedback loops can have long-term structural implications for the economic development of the nation as a whole. So, ladies and gentlemen, in the absence of the resources to fund huge conventional expansions in public healthcare infrastructure could, and again this was alluded to by Mr. Stefanos, could technology provide the answer? Well, this brings me actually to the next topic, which will be discussed and deliberated upon tomorrow, and that is technology for saving lives. Technology, ladies and gentlemen, forms the backbone of the healthcare delivery model of the future. And I will hand over to Dr. Alok Roy to talk about, to expound on and talk about the theme for our tomorrow's deliberations, which is health tech for saving lives. So Alok, over to you.
Thank you, sir. Good morning. It gives me great pleasure to be here amongst very esteemed panelists. And, in our life as a doctor, we get sweets in Diwali. But and all my IAS, IPS, and politician friends get sweets and everything around the year. Now what happens, suddenly the economy of sweets changed. And we get now tons of sweets and cashew nuts, especially when the new things come in. Like since the Dirty O made its appearance on 23rd November, again my house is full of sweets. All those who think they might get it are sending me. Now I don't know how the economy works. In our life we never thought that we would be standing shoulder to shoulder with economists and think tank discussing about how does healthcare change economy. But teeny weeny virus coming from all the way from China has destroyed all of us, our economy. The very fact, the moment I entered, the PwC consultant, Mr. Shantan asked me, Dada, ki hoche, what is happening? The Dirty O has arrived now, what will happen to economy? So the very fact that health is linked. And we were kept on saying for many, many years. I've been practicing for the last 40 years, 45 years, to be precise, in healthcare. And whenever we said that good health is important, even for education, nobody heard it. But we realized that now, this one small virus, you can't even talk to anybody face to face. If two people are standing, one is talking, one will put on the mask because he doesn't know that whether we are breathing the same air or he has contaminated or I'm going to contaminate his air. The very fact that every aspect of our living, every aspect of our survival has been threatened, we suddenly realized that healthcare and economy are hand in gloves. You can't sustain without either of us. Medica has been holding the Health Tech Summit. We felt that we need to talk about technology in healthcare for the last many, many years, where Bengal Chamber and Medica Hospital, we are partners, and all our other hospitals support us in this endeavor. We all work together. And when Mr. Lahiri spoke to me, and he talked to me about CENERS and how they are a think tank for northeastern states, I said probably this is an opportunity to land up together and talk that how we are interdependent on each other. Technology will only save us from impending gloom and doom which is being said and written about economy. And I'm glad that I was heard first time by economists. Never heard myself, got heard by them ever in my life. And we have a very, very great panelist. We have got Professor Reddy with us. We have Dr. Sangeetha Reddy from Apollo. We have Dr. Niranjan Mishra from Odisha. Many of us, our health secretary is here. My esteemed colleague, Dr. Kunal Sarkar, the very fact he'll compare it shows that we are bum-chum now. So without economy, you can't survive. Without health, you can't survive. Let's ensure that both of us survive. Enjoy deliberation for next 2 days. Let me tell you, it's going to be greatly beneficial for the not health economy. Thank you.
Thank you, sir. We now have Dr. Sangeetha Reddy, Joint Managing Director, Apollo Hospitals, who has joined us online. So we would request Dr. Reddy to please address us.
Good morning. Can you hear me?
Yes, ma'am, we can.
So, namaste and a very good morning to everybody, all the dignitaries on the dais, the organizers, and all the healthcare evangelists who are so much part of transforming healthcare. Dr. Srinath Reddy and other distinguished members of the panel, it is my pleasure and privilege to be amongst you this morning. And I want to begin by congratulating you for putting together this very powerful and much required focus on health for inclusive growth. Soon it will be 2 years since the WHO declared COVID-19 outbreak as a global pandemic and a crisis that has profoundly affected lives and livelihoods. Yet I must say that something very positive has emerged from this warlike situation that has really spared no one. And that was that health became center stage and health has become a priority. Whether it's corporations, individual homes, governments, everybody is thinking and talking about health. And we've moved well past that concept that health is our real wealth was just an adage. Today, everybody realizes that health is indeed so significant. And the devastating economic impact of the pandemic really underlined this fact that the wellness of a nation, economic and health, are both intrinsically intertwined. Now, the crisis overwhelmed the healthcare ecosystem in several developed nations, and it consequently drew humanity's attention to really how important this was, the importance of building new healthcare models which were resilient, innovative, inclusive, and covered every part of society. The importance of primary healthcare, of comorbidities, all these came to the fore. And in the same breath, we realized the importance of research, of innovation, of speed, of new solutions, the vaccines, and the speed at which the world has developed vaccines, found the cures, scaled them up, and rolled it out is something which has hitherto never happened. And I must say that our nation, India, surprised the world in how well this crisis was managed. Of course, we had a devastating period during the second wave, but basically, overall, our healthcare workers stood up, our doctors ensured that no effort was spared. The government at multiple levels, central and government, really worked together. And technology played a huge role in this success. Our tracking models, the scale up of testing, the containment models, the lockdown, the recovery rates that we showed, the contained mortality rate, and administering over 1 billion doses of vaccination, each one of these is a significant milestone. And clearly, these are successes that reiterate India's inestimable power when we come together as a force. And I think this prelude of working together must be something that we continue to do as we go forward. I also believe it's very pertinent, this pertinent summit, which is being organized by BCC&I and CENERS-K, is all about this. It's about harnessing the power for inclusive growth, of ensuring and enabling that society, corporate, science, government, doctors, nurses, and all healthcare workers come together and ensure that this inclusive growth creates an all-new definition about being humane and driving true progress at all levels. Further, I think it is well acknowledged that the custodians of healthcare, many of you in the August gathering here in this summit, and the subject which is being discussed, we must ensure that the goal is all inclusive. It's not just about treatment. It covers prevention. It is ensuring that the inequalities in access to the healthcare system, that quality is enhanced and cost is controlled. And I believe this summit is a brilliant platform for change makers. And change is hard, but change is a constant. And now we have learned this lesson very quickly in the last 24 months. And the stage is now set for healthcare to become an enabler for economic development and inclusive growth. I think a strong definitive is that good health promotes economic growth by ensuring productivity, expanding the labor force, and also delivering immense social benefits. And therefore, as a young nation with over 65% of our population under the age of 35, India needs to lay a greater emphasis on public health and a lot more on spending on health, disease prevention, research, and universal access. I believe that the foundations which have been laid by the government, whether it is the Ayushman Bharat or the concept of universal access, whether it is the National Digital Health Mission, the strengthening of the health infrastructure, and the partnerships that we are forging, as well as the strengthening of research, all these are steps in a very important, significant journey. I think it was, very clear that better health had this correlation with better economics. And WHO estimated that a 10-year increase in average life expectancy at birth is associated with an economic growth addition or uptick of approximately 0.3 to 0.4% in GDP per year. And I think this is a significant factor because as you see, not only is the population across the world now stabilizing and in some countries there is degrowth, it is important for us to link good health and longevity to the economic indices. And further, infant mortality rates coming down, life expectancies going up, and these typically precede an economic surge in any country. And history and evolution has shown this. So it's important for us now to focus on healthy longevity. And simply this translates into health being a clear causative factor for an aggregate economic growth of the country. And in the present day, while management of COVID-19 continues to dominate the mind space, especially with this new variant, it would be amiss if one does not acknowledge that on many, many indices, India is actually a lot healthier than we've ever been before. As a nation, we've eradicated smallpox and polio. We've made great strides in HIV infection and AIDS related and seen this tremendous enhancement in access and affordability. However, now it's also important that we focus on the underlying pandemic, and that is the pandemic of the growing prevalence of non-communicable disease. And based on an estimate from a discussion paper from the Institute of the Study of Labor a few years ago, it was observed that by 2030, non-communicable disease or NCDs will cost India a whopping $6.2 trillion. It is time for us to act now. And NCDs are so much lifestyle disorders that they are in the hands of the individual. We need to also transform the healthcare system itself and move from a sporadic, episodic, treat people when they're sick environment to a ubiquitous access to health information and knowledge, to a staying healthy and prevention, to wide-scale screening, to affordable, available medications so that people do not stop medications, whether it's blood pressure or diabetes medication, because of the economic impact it has on their household budgets. So there are multiple things to be done in this arena. But the power is that technology will enable us, and the knowledge that we have today about so much of behavior, consumerism, access to individuals, all these technologies which have already been used, whether it's in the banking sector or in the retail sector, are now coming to bear in the healthcare sector. Let us channelize them not towards more treatment, but towards greater prevention and a healthier environment. And there is absolutely no doubt that healthcare is at the fulcrum of inclusive growth, must be a national priority, and collectively we can bring about almost a tectonic shift within the decade if we begin to act now on non-communicable disease and its prevention. India is clearly committed to the SDG target of 2013, and our aspiration should be for a healthy India, where health-aware and engaged individuals have equitable access to affordable health coverage with a focus on prevention, early diagnosis, and a good quality of care offered in a vibrant, sustainable ecosystem of public and private providers coming together in a seamless manner, enabled by an underlying technology, the Internet of Medical Things, and most importantly, a high ethical standard. This standard and this commitment to our patients, this commitment to the health of the population, combined with the evolving technologies that we have, can truly shape our collective tomorrow. I would like to conclude by sharing, one of the models which I believe is clearly important. We are in an era where we are celebrating our highest technologies, our MRs, our CTs, the robotic surgery that's happening, the proton therapy, artificial intelligence, 3D printing. All these are coming to bear, and I think we are enthusiastically embracing these adaptations and changes. And we are becoming more minimally invasive, pain-free. Patients are much happier for so much that is happening. But I want to talk about the population health and an initiative that we began almost 20 years ago in a small village. And here we started with telemedicine and a health insurance program for 1 rupee a day, which enabled people of this village, about 7,000 people, to have access. In 2013, we began a population health model under the aegis of the Total Health Foundation in Aragonda in Andhra Pradesh. Today, the Total Health is built on a strong foundation of social innovation, of women empowerment, of access to the social determinants of health, clean drinking water, sanitation, nutrition, cleaner environment, and the combination of lifestyle, of alternate medicine. We have almost 37 yoga trainers who go across now. The one village has become an entire mandal, and about 68,000 people are covered. We did the WHO STEPS methodology, screening and documentation for this entire area. And then as the interventions of screening, cataract, early detection of cancer, blood pressure, diabetes control in a holistic manner, as well as the mother and child centers and nutrition, I'm really happy to say that over the years, the Total Health Program is now showing a deeper engagement of the community in healthcare, lower indices of all mortality rates, and now the incidence of cancer and diabetes as well. And I believe that this model is replicable, it's scalable, it empowers the individual to take responsibility, and the village, the panchayat, the social workers, the women, to take responsibility for the health of their community. And this could be one of the additional transformative steps as we move towards a healthy India. I want to thank all of you for the continued support and the good wishes that all of you have always given our organization, and commit on behalf of Apollo to always remain a part of the medical community, the Indian medical community that I'm very, very proud of, and wish you all the very best. And in advance, very Merry Christmas and a Happy New Year to each of you, and congratulations once again. Stay healthy, stay safe. Namaste.
Thank you, Madam. Dr. Sangeetha Reddy. As we proceed with our opening session, we have the keynote panel on health for inclusive growth in this session, and it will be moderated by Dr. Kunal Sarkar, Senior Vice Chairman, Senior Cardiac Surgeon, and Head Medica Institute of Cardiac Sciences, Medica Superspecialty Hospital. This session is being joined by Sri Narayan Swarup Nigam, IAS Secretary, Department of Health and Family Welfare, Government of West Bengal. Mr. Arnab Basu, Vice President, the Bengal Chamber and Advisory Leader and Partner, PwC India. Professor K. Srinath Reddy, President, Public Health Foundation of India. Ms. Suchita Gupta, Chairman cum Managing Director, National Insurance Company Limited. Dr. Rupali Basu, Managing Director and CEO, Woodlands Multispecialty Hospital Limited. So we have Dr. Kunal Sarkar, Mr. Arnab Basu, and Ms. Suchita Gupta here with us. We would request them to please join us on the dais. We are having Sri Narayan Swarup Nigam, Professor K. Srinath Reddy, and Dr. Rupali Basu joining us online.